Tea with Suzanne. I should say a special episode of Sipping Tea with Suzanne because when Dr. Crista calls you and says that she needs to be on your platform, the answer is a yes, and you figure out a way how to make it happen. So I am so excited to be in the studio today with Dr. Crista Johnson-Agbakwu. How are you? Welcome to the
I'm
show.
doing wonderful. Thank you for having me. It's truly an honor.
It is an honor to have you on the show. I'm just really so excited. And, there was a reason for you being this day because we're going to talk about a little in the show with a big event or a big week coming up. And I really wanted to make sure that, we got you on the show and really highlight that platform, but also wanted to talk about you and just all the incredible, amazing things that you do.
Thank you so much for having me. I'm really looking forward to sharing
Yeah.
and really sharing with your audience.
Yep,
A little
absolutely.
more.
Thank you
Thank
so
you.
much. So, for those of you joining for the first time, thank you so much. I know it's your first, hope it won't be your last. And for those returning viewers, thank you so much for your consistent support. I appreciate it. I'm so excited when I get a chance to really chat with my guests and find out about them and, inspire you guys to just go out there and do the thing. Also, want to shout out our executive producer, Paul Anderson, for making the magic happen week to week. And, honestly, before the show and after the show, like it's our sweet spot because we get an opportunity to talk to the guests and we're so candid. And, right before it came on, we were just started this really deep conversation. But first I wanted to say, hey, welcome to the show. You were
Thank
on the
you.
show before,
Hmm.
but in a different format. So I think, was it 2 years ago?
I think so.
Yes, right before Dr. Sharice Hamlin moved to Massachusetts to take on the role. It was you and then medical student,
Yeah. Anaya.
yeah,
Sanders, yeah.
Anaya, and another and a mother advocate. They were on the show and we did this really really great episode. But this is an opportunity for me to chat and talk, find out about Dr. Krista, who we're going to find out some stats. Who's in the 0.8 percentile of her field. And you said that a few years ago. It was the Stand Against Racism breakfast
Oh, yes.
through the YWCA. And it was just such a staggering statistic because you're like, I'm in my mind, I'm like,
Not
wow,
something to be proud of.
it is not. And I mean,
It's a problem.
so it's tough, right? Because it's like, yay, kudos to you for being in that field, but oh my God, it's
We need to
it's
change
like
it.
the pressure, and you certainly we need to change it. We need to figure it out that there is more individuals that look like you, because I often said, oftentimes the folks that are making the decisions about us, our
Yes.
lives, the way we dress,
Yes.
and our
Do not.
reproductive
Exactly.
health doesn't look like us, doesn't understand us. That's how we
Exactly.
went to times when they used to experiment on black women
Absolutely.
because we apparently didn't feel pain.
Absolutely. Yep.
So,
And we have not come far from that era.
which
We're
is
still in it.
so
Yes.
scary, right? Like
Yeah.
we have
Yeah.
heard harm being uttered
Mhm.
recently, and about how we are and how we don't feel certain things and things like that. So yes, I am truly very proud of you and truly honored to know you and have you in my circle, and to know that I know someone who's in the 0.8. But then on the other hand, I know you're like,
We need
let's
to change
change this. Let's
Yes.
go. Let's just push it. Like we're not even at 1%.
Mhm.
So
Yeah.
welcome to the show.
Thank you.
What a
Thank
setup,
you.
right? Well, welcome
you.
to the show. And we're going to talk about Black Maternal Health Week, which starts tomorrow. But before we do that, I really want to get an opportunity to talk about you and just, one of the things I had noticed when you came in, beautiful shirt, and you always represent
Thank you.
yourself, like showing a bit of your culture. And I know that's important to you and that's intentional. And I've had a lot of conversations recently about that because I chose to wear my hair, choose to wear my hair in an afro, and
Yep.
I get a lot of
Oh yeah.
push and
yeah,
pull with
yeah,
that and the colorful colors and
Mhm.
things like that. But why is that so important for you to show up as your full authentic
Yes.
self?
Yes. And this has been a journey.
Yeah.
A journey over my entire career, honestly.
Yeah.
So, first of all, just my origin story. I am proudly a Jamaican American, a Yankified pigment, and that my grandmother, my mother's mother, immigrated to the United States in the 1960s. Back then there's a huge history of Caribbean migration to the United States, looking for better job and economic opportunities for themselves and their children. And so my grandmother was the first in my entire family on both sides to come to the United States. And she sent, like many Jamaican and Caribbean parents, sent for the kids, little by little. And so my mom came to the U.S. as a teenager in the late 1960s in Connecticut. So that's why my roots are in New England.
Yes.
In just an hour south from Worcester in Hartford, Connecticut. And my mom met my dad in college, who also immigrated from Jamaica. But this was in Michigan. So I ended up being born in Michigan. But when I was about 4 years old, my parents moved back to Hartford and with my grandmother, and that's kind of was home base and still is. My parents, thankfully, are still alive and well.
Amen.
In Bloomfield, right outside of Hartford. And my parents were strong pillars in the Jamaican and Caribbean immigrant community in Hartford. And I feel like my walk and my journey really came from them and their inspiration to always serve and give back and always look out for how you can make a difference in your community. And so me growing into my power and my strength in showcasing the full authenticity of myself and my being really was an evolution. You know, when I think about going through college and then in medical school, I was in New York City. I remember distinctly, this was in 1999 as a fourth-year medical student. Back then, in the late 90s, natural hair was just coming into being, with, Lauryn Hill and Erykah Badu, those were the artists back then. My hair was natural in two-stranded twists. Been through the perm and the jerry curl.
Yeah, girl. Gotta try it out.
Exactly. But I was wearing two-strand twists that were fairly short when I did a rotation at a hospital in Massachusetts, in Boston. And I was told, when you come back as a medical student, when you come back for your interview, straighten your hair.
Wow.
By a well-meaning professor who felt that because I was the only Black medical student, the only Black potential resident that the program had seen, that the older white male attendings would take offense to my ethnic appearance.
Wow.
Back then, I didn't have the power and the fortitude and the strength and the resilience, I feel, that I have now, that journey that we are all on.
Yeah.
And do you know, I straightened my hair to show up because, you're holding the blade. Like my dad always said, you either hold the handle or the blade. You want to hold the handle because if you're holding the blade, they can shook you. Right?
Yes, cut you up.
Exactly. And so back then, I was like, well, I need to get into residency. I need to pursue my career. I don't want anything to get in the way of what I'm trying to pursue. And so I bit the bullet and straightened my hair. And I made a vow. Yeah. I'm never going to sacrifice my authentic self, right? And as I rose through the ranks and continued my training, something that grew in me and matured in me was a passion to always stand firm. Because when you stand for one, you're standing on the shoulders, first of all, of so many giants who've come before, And I'm here because of them. Yeah. I'm here because of those who've come before and paved the way. So I have a responsibility to reach back and pull others along. And part of that is representation. How do you show up in spaces? Yeah. How do you show up when you may be the only voice to advocate for what you know is right, what aligns with your values? As a Black woman, as a woman physician, as someone who is woefully underrepresented in medicine, how do you speak truth to power to speak up for those who may not have that power or recognize that power or may have the barriers to be able to advocate for what we know is the best for them? And so I have really harnessed and embodied this as I've rose through the ranks to know I am going to make sure that as I speak with authenticity, it embodies everything that I represent, which is pride in my cultural heritage and also pride in from whence we've come. We didn't start off as enslaved persons. We were powerful kings, queens, princesses, princes, with high intellectual, contribution to this world. And that so much of that was stripped because of, especially in this current environment, how all the banned books and all the restrictions on understanding our history. We as a people must know from whence we come. So we know and have clear-eyed vision on where we're going, knowing that we stand on a legacy of giants. Resiliency is in our DNA. And so that's what I embody and I represent in my role, that you're going to see me, but you're also going to reflect in me my strength, my resiliency, my resistance, and showing up with my hair natural, with colors and patterns that represent my ancestry is part of my resistance. And that power that I want to impart on all those who might hear my voice and be inspired that, oh, I can do that too. Oh, I want to be like her. Because we need to pass the baton to the next generation who can take my place and take it farther.
Absolutely.
Right? Because I'm here for a time that God has put me on this planet to advance good work, but it's not about me. It's about, how do I pay it forward? How do I advance the work? How do I get more people to jump on this band? Because this is about survival. This is about our existence as a people and our survival and our legacy to ensure that my daughters, all of our daughters and sons, can live in a world where we don't have to live with the same racial oppression and bias and discrimination that our ancestors have survived through, and that we have lived through, and that we continue to experience weathering because of the structures and systems that continue to harm us and threaten us. So me showing up in any space, I seek to be intentional about representing my cultural heritage and my ancestry in as a sign of power, resiliency, strength, and confidence that I belong.
Yes.
I am enough. I am exactly where I'm supposed to be. And how can I inspire the next generation to take this baton and take it farther than I could have ever.
Absolutely.
With the privilege and the access and the benefits that I have standing on the shoulders of giants that have paved the way before me. So I always seek to represent in that way, because you never know who you're inspiring by them seeing you. And they're like, you're doing what? Where? Wait, I can do that too.
Absolutely.
It is absolutely essential that we inspire the next generation. So I seek to embody that fully and authentically in everything that I do.
And you do it well. I think, honestly, from showing up with the hair to the colors that represent your heritage. And, my heart breaks for you, because I've had that experience. So many Black women that I know have had that experience, right? Because when you start out and you are the only in the role, and absolutely we don't want to be the whole only, but when you start out, you're the only in the role, like you have to conform, or you were like, if you hadn't made that decision, would they have been offended with your natural hair and not gotten the opportunity? And girl, you're Jamaican, you would have figured it out. Like you would have, if not them, God will always make a way somewhere else. But when we're just starting out and we have that responsibility on our shoulder, that's not our thought. Like, somewhere else is going to take me. Like, I have to get in, because sadly we view it as our failure versus it's their failure to recognize that me having natural hair does not impact my intellect, right?
Absolutely.
So I feel that, and I know that Black women watching this are feeling it, because they're like, I've been there. I've been in corporate roles where I was told it was too colorful, my hair. It's just like when I wore even certain styles, it was like, can I touch it? Or, like, wow. It's just like the exclamation. It's just, sometimes it's easier to just like blend in and do the thing. But I respect that and I appreciate that, because it's like, they're going to know it's Dr. Crista. And it's like, if they know what they're getting, and if, they want you to speak, I know you've spoken at a conference all over the world, right? And if they're going to say like, oh, and, make sure you're out.
Exactly.
And you're at that level now where you can say, if you can't take me, then you don't want me.
Exactly.
You don't want me. You want me to look like you, but sound, I don't know where they're going with that. But so no, thank you for sharing that. And I absolutely know that little black girls seeing you embracing that and being in these stages and places can absolutely see themselves represented in you.
And we're all on this journey.
Absolutely.
And I'm still on the journey.
Absolutely.
It will continue until I take my last breath.
Yes.
I always want to know that in every stage of my life and my presence and my being, that I'm being authentic and I'm representing for those who may not be sure or still, timid or not quite ready. But guess what? Maybe I might inspire them.
Yes.
That they can stand even more in their truth.
Absolutely.
Because they saw me or heard me or I inspired them in some way.
Absolutely.
Yeah.
So I love something you said earlier. I think when we are the first, and you also said we have a responsibility to reach back and pull someone forward. So when you started at UMass, you were the first Black OBGYN that was at UMass, and
I don't know for how long, but it was for a long time.
For a long time, yes. But that's not the truth anymore. That has changed, and you were intentional about it and ensured that, because you can't serve every Black woman in the Northeast.
And what was shocking to me?
Yeah.
For an academic medical center of this size, as the premier academic medical center for Central Massachusetts, here in Worcester, as the second largest city in all of New England. Yeah. My jaw hit the floor. Yeah. When I heard there were not more of us serving the community, which has a Black population of 13 to 15% here in Worcester. Very high. And we don't have that representation among our healthcare providers. That I was blown away, just astounded. Yeah. That how are we in, this day and age, not doing something radically to change that? Because we know, and the evidence is strong and growing every single day, that when you have communities where you have greater diverse representation of healthcare providers who look like their patients, who share some kind of racial, cultural, linguistic congruence with their patients, their care is better. They live longer. We know life expectancy, studies show life expectancy climbs when you have a zip code that has a greater proportion of providers of color. Yeah. Right? That to me is just like mic drop. Like, what are we doing? Why are we not really seeking to nurture those pipelines and pathways to make sure that our healthcare workforce represents our community, especially such diverse communities as who we serve right here in Worcester? And you were talking about that 0.8%. Yeah. I'll give you some context. Here in the United States, African Americans represent 13% of the U.S. population. However, among the healthcare workforce, among medical professionals, we represent only 5% of medical professionals. When you break it down to just women medical professionals, physicians, we represent only 2.5% of all physicians in the entire United States. And then someone at my level, very senior, full professor, at an academic medical center, I represent 0.8%. Yeah. I mean, the numbers just get smaller and smaller. And that's so unacceptable.
It is. It is. And
I don't want to be an only.
No, absolutely. It's lonely. And I mean, and as much as I would love for you to live forever, we won't live forever, right? So your job is not to take it with you. It's to pull them forward. It's to pass the baton so they can go higher than we ever dreamed possible. It's kind of, when Kamala was running, they was like, Shirley ran so that Kamala could be on the Democratic ticket as the president of the United States. Well, we all know what happened, but the fact that she ran, how many little Black girls were inspired by that? So we have to start planting the seeds now.
Even for President Barack Obama, when he was president, the data showed high school Black male achievement rose.
Yes.
During those 8 years of his presidency, because it's like, I can sit a bit taller. Look who's in the White House.
Absolutely.
Right?
Listen.
It's like, We see it. The data speaks for itself.
It does.
Representation is everything.
It is. It is. Like, we're so proud. Like, I cheer for folks, but when I see someone who looks like me, and honestly, we're like, no, you don't want to be the only, but when you see the first person like there, you're like, yes, because for me, that represent, yes, like there's one in there, like more is coming, right? Like we bust open the door so others are coming, right? Right now, the guy in NASA, the captain, like, all right, I have no interest in being an astronaut, but like, here I am, like just inspire those, little black boys and little black girls who never saw themselves on the moon, things like that. So it's so important. And you are right. There is this pride when you see it, and it just rejuvenates you, right? And you're like, yes, he did it, and so can I. And that's what we need.
Absolutely. And that's what it's our obligation.
Yes.
We must. It's not even maybe or think about it. We must. We have an obligation. We must pass that forward and inspire the next generation, starting with our own kids, our communities, those touch points of connection, but also those who may only hear us through your podcast or through, other forms of media, right? This is our responsibility to give back and advance this work, because this is a work beyond any individual person. This is a work of generations, of our lifetime.
Absolutely.
And this is the work of our community.
Yeah.
For us to move us forward as a people.
No, absolutely. When you were talking earlier, and you talk about the importance of having diverse representation in the medical field, and I think about a recent experience I had. It was like, I think it was a year or so ago, and I think I might have shared it with you. So I went to the doctor with my daughter, and it was her physical, and the lady who does not look like me walked in, and she saw us, and the first thing out of her mouth was, "I only speak English." Okay.
Wow.
Yeah.
Oh.
Wow.
And you had not opened your mouth?
I hadn't opened my mouth. She walked in and she saw me and my daughter, and she said, "I only speak English." I said, okay. I said, well, isn't that great? I only speak English also. And that's not a point of pride, FYI, because I think that we need to be multilingual. Like our kids need to be multilingual.
Yes,
so it's not a point of pride. But in that instance, I did say, well, hello, I only speak English too. And I'm pretty sure I speak it pretty well, but we're not going to go there. So, all right. And then but throughout the interaction with my daughter, when she asked questions, she was just like, how many people live in the home? So my husband and, her sister. Oh, okay. And then, she asked, so do you play sports? So, my daughter, she does dance, she does piano, she does cheer, and, and all of these things. So, but each question, she was just like, oh, she looks at her, every time, we answer a thing, any history of smoking, anything and I was like, okay. And I was like, I'm sorry, are these questions necessary? Because it's kind of like you're surprised by her chart and you want to fit her into this demographic or this thing that you have in your mind. And I'm sorry, I don't fit into that pattern because we are not monolithic as a race, right? Yeah. So, wrapped it up. And when the nurse came in, I told her, I was like, worst experience ever. My mom happens to know the CEO, and I recognize that privilege. I do. And I did tell my mom about the experience, who told the CEO of the organization at the time. But many women who look like me do not have that opportunity. And what happens, they have that experience, they clam up, they don't share, because I didn't share with her anything that was happening. I was just like, I was done. I mean, truthfully, I should have walked out, but I was like, just because you're disrespectful, I'm not gonna do that. So we got through it, but then I didn't share anything. I'm not gonna ask any questions. When it came to questions and concerns, I had none. I don't wanna have a conversation with you. How many women like me are facing that?
Countless. Innumerable.
Yeah.
And I'm so glad you shared that story, because that's literally at the very core as to why we need to radically change the way we provide care. Because it's not just about checking the boxes of, oh, she had a healthy delivery.
Yeah.
Right? Or she didn't die. Really? Is that the goalpost? Right?
God.
Right?
Yeah.
But what was the experience like? How do our implicit or unconscious biases, shaped by society, shaped by our lived experience and our worldview that may be very insular,
Mm-hmm.
how do these biases sneak into the snap judgments we make when we have somebody sitting in front of us that doesn't share any orientation to our worldview or lived experience? How do we then provide quality care without letting those inherent biases override our judgment?
They don't.
Right? And so you give a perfect example of some of the encounters that are pervasive through all of medicine and have a historical legacy in not just these stereotypes like what you're describing, but also how we as a people were embodied from the very founding of this country, right? So in order to understand why are we here in the year 2026, right, with these dire outcomes of Black mothers more likely to die at rates 3 to 4 times any other population, right? How did we get here? We have to understand from whence we've come. Go back to 1619. Go back to the original founding of this country grounded in chattel slavery and how we were not considered human, which justified enslavement of our people. And how, when my field as an OBGYN was founded in terms of just the very techniques that I trained on, using instruments named after people who violated and harmed my people, right? You understand how we got to where we are right now. When you think about cesarean section, which is where you have to, instead of a woman delivering naturally, may have to give birth through her abdomen. The very technique of how we have perfected this procedure was on the backs of enslaved women without anesthesia. Because we were not considered human. We were considered impervious to pain. We had, we didn't have nerve endings that were responsive for pain. And so as enslaved women, we were operated on without our consent because we were enslaved over and over again to perfect techniques such as cesarean delivery, such as fistula repair, not because they wanted to altruistically heal our bodies, but because they needed us birthing babies so that we can populate the plantation, right? Because our worth and our commodity was how many more enslaved people can we get out of this woman? We were systematically raped. When the transatlantic slave trade ended, we were systematically raped as women on plantations to give birth to future enslaved boys and girls, men and women. And so doctors made it their livelihood to treat the ailments of enslaved populations because they needed our bodies to continue birthing babies. So we were better, in the fields or giving birth, having more babies than having a fistula and of no use to the plantation because we're leaking urine, we're leaking stool. And so that's how our field that's what, created the many of the procedures that have been, fine-tuned since then originated during those eras where we were experimented on and operated on without recognition of our humanity, without anesthesia, without consent, right? And that has continued. The fact that, there are all these perceptions that, we have too many babies and we're super fertile came out of that legacy. And even the forced sterilization programs in the early 1900s, the eugenics programs, that was federally funded. Federally funded to restrict our reproduction. Because we were thought to be feeble-minded, promiscuous, girls would be raped.
Meanwhile, we're being raped.
We are criminalized.
Yes.
Right, and thought, she needs to be sterilized because she is unfit for society, right?
Yeah.
This was in the early 1900s. Over 8,000 women were forcibly sterilized. And not just Black women, in Puerto Rico as well.
Yes.
This is pervasive in Puerto Rico as well. And we are not strayed too far from that because to this day, in ICE detention, there are reports and publications of women also undergoing forced sterilization because they're undergoing hysterectomy without proper consent, or they underwent procedures where they didn't know they no longer can reproduce.
Yeah.
So this is not just a relic of the past. This is still happening
to
right
this
now.
day. Yeah.
Right? And some of these whistleblowers have brought that to the attention in recent time of what's happening to migrants, right? In detention.
Absolutely.
So we have to understand the sin of the past and the vile atrocities of how we have been dehumanized and how stereotypes about who we are as a people perpetuated over time to where we are right now, where you can have a provider look you straight in the face and have all these assumptions and biases about who you are and what language you speak before you even open your mouth, right?
Was a look.
Exactly.
That's it.
There was a study that was just published 10 years ago out of the University of Virginia among medical students and resident physicians in training, where they filled out a survey on just the perceptions and beliefs about the differences between Black and whites and their perception of pain. This was just 10 years ago.
Yeah.
2016, not that long ago.
No.
Over 50% of these learners endorsed on the survey that they agreed with these false statements that Blacks have thicker skin, you know, smaller brains, less sensitivity to pain, they are quicker, they are more fertile. All these false, completely false beliefs.
Yeah.
How are more than half of them endorsing that this is truth? Wow. We are failing the generation of healthcare providers who are taking care of us and our children.
Absolutely.
Right? If this is the perception
that's
of
their belief.
Current physicians in practice.
Absolutely. I mean, the current health secretary actually spoke that he believes that Blacks don't feel pain as much as others. And I'm saying to myself, if the person responsible for the healthcare system in the United States, the health secretary, thinks this, he's just bold enough to say it. How many more think that?
Exactly.
And I think that's why we continue to have challenges, like, you know, and, you know, and when that happened to me, like, it was important for me to report it. But the other thing is, like, a lot of women, because there could have been a woman who English wasn't her first language, and automatically it would have been shame.
Absolutely.
It would have been shame. And it would have been, yes, you're living with multiple family members. Again, there would have been shame. We're not the only race that, I mean, it's actually considered, you know, a privilege to help family members because have you seen Rent?
That was our legacy. That was what we did as immigrants coming to the United States.
Absolutely. Like, and we're not the only one.
Absolutely,
so I thought about that, and I'm thinking to myself, this woman has caused harm and probably has not listened to patients that look like me, and patients that look like me is not going to tell her the truth. And how many undiagnosed things or things that have gotten worse just because, and it's not just one. That's the sad thing.
Delay in care seeking, underdiagnosis, late diagnosis, right? And when you look at check the box of every single health outcome, diabetes, high blood pressure, stroke, heart attack, birth outcomes, name it, cancer, every single health condition in men or women, young and old, right? We are at the top in terms of the worst disparity.
Absolutely.
That's not by accident. That's structural. That is the elephant in the room, that we have not fundamentally addressed structural racism and the original sin of this country, right?
So,
and how we continue to fail our communities because of policies, right? Redlining, perfect example. The historic redlining, while it doesn't exist right now, the vestiges of it endured for decades.
They did, yeah.
Where you could not get a loan to buy a home in a particular neighborhood because of the banks would not give you that loan, right? And that resulted in economic disinvestment in communities. And studies have shown that when you look at historically redlined communities, that the birth outcomes in terms of preterm birth and very low birth infants, and some of these adverse birth outcomes are more profound in zip codes that had historic redlining, because we have, even though we no longer have redlining practice, but the vestiges still persist in terms of the economic disinvestment, resulting in food deserts, maternity care deserts, you know, housing, insecurity. All of the social and political determinants of health have legacy. It didn't just snap and birth overnight. This has been due to systemic policies that have been in place for, you know, decades, if not centuries, and have evolved and persisted and continue to result in communities that have, you know, and you see it, social vulnerability based on where you live absolutely matters. If you live up on Salisbury Street versus Kelly Square, you have a completely different life expectancy right here in Worcester.
Yeah.
That's legacies of policies and legislation and structural factors that have resulted in inequities in terms of access, resources, education, jobs, that have disinvested in certain communities and not others.
No,
right?
absolutely.
And so that's how we're here. But the other piece I wanted to emphasize is, for us as Black women, it's not just women who are poor, socioeconomically deprived, with limited education, right? It is irrespective. That's
absolutely
the elephant in the room of racism, and that regardless of our income, our education, you know, our where we live.
Absolutely.
Right?
Sometimes our proximity to whiteness,
Yep.
think it's not exempt, doesn't make you exempt.
Nope. Because of who we are and racism, irrespective of these, we still have harm. And that's what many people may not even recognize, right? And it's because of what we are not dealing with at the core, is how do we combat structural racism that underlies everything in our society, right? In terms of who ends up being able to become physicians and nurses, right? And it's only made worse with new policies.
Yeah.
We saw the cap on loans, student loans, for those pursuing graduate professional careers. You know, more physicians and nurses of color choose to work in communities of color. That's a known fact. But if you now restrict their ability to get student loans to pay for that education, how are you nurturing a pipeline to ensure that you have diverse representation in communities of color that are often served by physicians and nurses of color?
Yeah.
Right? So you see how we are going to be exacerbating the existing disparities in the coming years because of policies and legislation that end up harming our communities.
Absolutely. I mean, honestly, I say to Paul, I mean, I hope that what's happening right now under the current administration, there's just so much harm being done to us. Like, I think yesterday was about, you know, the cuts to HBCUs and all that. And there's all these things that are happening. 2028, I'm like, I don't want to wish my life away, but it shows that Congress is not ready to step up and do what they need to do, right, to invoke anything and get anyone out. But I'm like, hope in 2028, whoever becomes president has a lot of work to do, because we weren't where we needed to be. And this current administration has scraped back. So it's just like, we weren't even hitting what we needed to hit. And then we're slowly peeling away the things that we have gained, all the protection. So then it's just like, just to go back to like, so we're 1 out of 100. Let's say we were at 60%. Now we're 20%. So then then we have to go back. It's going to be a long fight to even get back to 60. So when we will not see 100% in my lifetime.
Absolutely.
And
You're
it's
right.
really scary and it's really sad, but we can't get disheartened. We've got to continue. We've got to continue with people like you doing what you do to ensure that, you are advocating for racial equity in so many different places and spaces and showing up as your authentic self. And that's why this that we're going to talk about next, Black Maternal Health Week. And, we're going to talk about it, but there's one thing I wanted to highlight, and I'm glad you talked about the fact that we're not, our titles, our income, our social economic status, like none of these things like separates us from being, we're a Black woman.
Absolutely.
Like we're a Black woman because there's still women that are as titled and as educated as you who still have challenges. I think, was it last year or the year before, a woman who actually advocated for Black maternal health passed away from lack of care.
Absolutely.
So it's like, if the very people that are advocating for it, that are quote unquote expert, are not getting the care, what about a young Black mother, a poor Black mother, 3 to 4 times
does not speak English, right?
Exactly.
Who doesn't know how to navigate the system?
Who doesn't know they could speak up?
Absolutely.
So we're going to dive now into Black Maternal Health Week, how it started and why it's important, and what's happening right here in Worcester during this week, and how we can get involved. So what is Black Maternal Health Week?
So this was a concept founded by the Black Mamas Matter Alliance. And it was founded to really drive a national, if not international, movement to raise awareness, to advocate for Black mothers, and to educate on the dire statistics. It is a public health crisis.
It is.
We are marching in the wrong direction, and we're the only industrialized nation moving in the wrong direction in terms of the rates of preventable death, as well as preventable severe complications in childbirth, right? And we think that we're tucked away up in the Northeast, in a blue state, that all the bad outcomes are happening in, states in the South that have, historic legacies of discrimination and barriers and limited access. But you'd be surprised, Worcester and Boston, these metropolitan regions with high concentration of Black and brown communities, we are right up there in terms of adverse outcomes for both mothers and children. And so, it goes back to what we've been talking about all along, in that, we need to really peel back the layers of the onion and look at some of the root causes. And some of the core of some of these issues resides in the fact that we still have failed to truly, diversify our workforce so that there are more birth workers of color who represent our communities across race, culture, language, lived experience, serving our community, but also expanding options for our mothers to be able to deliver in spaces that may be more safe, such as birth centers and such as midwifery care, there's been significant advances in policies that are advancing support across the Commonwealth for expanding options to increase the availability of birthing centers for communities, as well as increasing the quality of care for our existing hospitals that are serving our community. And so I'm really proud of the fact that at UMass Memorial Health, which is where I work as an OBGYN physician, 2 years ago we started the doula program founded by Dr. Sharice Hamblin, who is a dear colleague and friend of mine. We go way, way back to our years in Arizona. When we first met, she was in her residency training, and it was my first faculty position out of fellowship. We worked together for 3 years during her training in Phoenix, Arizona. And then she was able to, when she graduated, launched a beautiful career, really giving back in forging a workforce through a pipeline program that she developed, Patients Are Waiting, which is really centered around increasing diverse representation in medicine. And she also co-founded a doula initiative called Diversifying Doulas Initiative in Lancaster, Pennsylvania, that has done incredible work serving the local community in Pennsylvania and really helping to close a lot of those gaps in birth outcomes. And so when I was recruited to UMass and I looked around and I was an only, I was like, we need to change this.
Absolutely.
And, we had kept in touch in recent years. And I said, hey, we started, she knew about my recruitment to UMass. And then, once I had already signed on the dotted line, she was like, tell me more.
Yes.
And thankfully, we were able to recruit her a year after me. And she started the doula program at UMass Memorial, and it has grown tremendously. They've served well over 200 births that have been supported by a doula. She's trained up a workforce of dozens of doulas who are serving our community right here in Central Massachusetts, which we're so proud of.
Yeah.
And part of Black Maternal Health Week is to bring to awareness what we're doing to try to change these statistics. The theme for this year for Black Maternal Health Week nationally is rooted in joy and justice, which is so powerful because it's not just about all these mind-numbing statistics, which we know, are so dire, but it's also how do we resurrect our power, our strength, our resiliency, our joy. Yeah. Childbirth is the most natural thing on the planet. And we should celebrate our joy.
Absolutely.
The joy of childbirth, the joy of being in community with others, of being able to have a positive pregnancy outcome, a healthy baby. How do we wrap our mothers in a cocoon of support, which is the quote that Dr. Hamlin uses all the time in terms of how do we make sure that journey to motherhood and welcoming your baby is one surrounded by joy and support and seeing you as a human being, listening carefully, hearing you, honoring your requests, honoring your needs for pain relief, listening to any concerns that you have, responding to that promptly, hearing you, making sure we can advocate on your behalf, making sure that you have the language interpretation that you need, that you see someone that you can relate to, who shares your journey, understands where you've been, can relate to what you're saying, and can translate the medical jargon that's so scary through a lens that understands our community and and what we go through, right? And have that identity. That is so crucial in recognizing that, okay, I can breathe. I'm going to be okay because I have somebody who sees me, who hears me, who understands me, and will advocate for my best care. That's how it starts, that nugget of trust, right? And how do we replicate that and change the culture of how we practice medicine so that we're no longer having those experiences of bias, right? Where people are assuming things about us without having any understanding of the diversity of who we are and what we embody, right? That's at the core, honoring our collective humanity and seeing us as humans first, and recognizing, seeing us as you would see your daughter, or your neighbor, your mother, your child, right? That's where we have gone astray in terms of, the not just the biases, but the delays, the misdiagnoses, the lack of referrals, all the things that can perpetuate some of the adverse outcomes. And of course, improving access to care is crucial as well, right? And so you're more likely to follow up and follow through on what the provider is suggesting if you really feel like, okay, this person means the best for me and is looking out for my best interests, is going to fight for me, is going to speak up in spaces that I'm not there to make sure I get that care in a timely fashion. Everything matters.
It does.
And that's what we're trying to do in a holistic way, working with training up a workforce who can serve in bridging some of that gap, but also at the same time, educating our peers and our trainees, our students and our residents who are coming up and are going to become the future nurses and physicians and researchers, making sure that they understand the historical legacy of how we got here. What are the present issues? What are the public health issues? What are the structural and political determinants that are impacting how we see maternity care, right? It's not just the individual and blaming the patient or the woman or the mother. It's like, well, does she have safe housing? Does she have a safe place to exercise? Is she able to get nutritious food? Is she able to get to her appointments? Does she have transportation? Does she need an interpreter? Does she have consistent health insurance? Right? Can we plug her in with a doula, which is provided by Mass Health as a doula benefit as of December of 2023. Can we get every patient who wants a doula? Can they get a doula?
Yeah.
Can we train up doulas who are equipped to serve in this way and advocate for their patients? Can the healthcare systems welcome them in and encourage this partnership and collaboration that we can work together to improve this mother's care? Do you see? It's all the spokes of the wheel. It's not just one thing. It's this plus this plus this plus this. Like all these things need to work together.
Absolutely.
Right? And so you have to be pushing from all these angles, advocating on all these levels to make sure that you can support that mountain that needs to move, that will finally transform care, not just for one individual patient or family, but the entire community.
Yeah.
Right? So that work requires an army.
It
does. Cannot be one person.
Can't just be you and Dr. Charisse. No.
How do we get
So
all
much.
of us to
Absolutely.
recognize this and work together on the same page, understanding the importance of this work? And that's what we hope to amplify through Black Maternal Health Week. And I'm so thrilled because this year, the third year doing this, we have over 18 community organizations that have come together to help elevate and amplify this work and the importance of what we're doing and bringing to the Worcester community. And we couldn't do it without these organizations.
Yeah.
You know? And it's amazing. And I'm just so proud. I'm proud to be a part of Worcester and the Worcester community who've taken me in and embraced me these last 3 years and the importance of the work. But I'm also so proud of how we've electrified the entire community to raise up with a unified voice that this is important to our community. We must protect our mothers.
Yes.
And this is how we do this in a chorus that's loud and clear, that we need improved policy, we need improved access, we need the diverse workforce, we need improved processes of care to ensure that women, birthing mothers, have respectful care when they do, come into healthcare settings. How do we diversify the availability of birthing centers and midwifery care that can support our mothers? And it requires all of us working together to advance this work. And that's why I'm so proud of that we have been able to accomplish here in Worcester. And we're just beginning. We're
just year 3, just getting started. And so tomorrow it kicks off, but there is a plethora of activities throughout the week. If you want to, is there any central page that folks can go to find it all out? And then you can just throw out a few highlights of a few things that are coming out.
We have our living website through the UMass Chan Collaborative and Health Equity. It's Black Maternal Health Week, BMHW. And we have a QR code. Perhaps you might be able to include it in the.
I will figure out a way. When I reshare it, I will put the QR code in
and then
so
you
folks
can
can
see
scan.
the full spread of everything we have. Actually, starting this evening with the Hanover Theater, is showcasing Eartha Kitt and her life journey. And it's not the official kickoff of Black Maternal Health Week, but still, it's the night before, and that's happening exactly. But yes, tomorrow there are a couple events happening, one through the Worcester Division of Public Health and the other through the Together for Kids Coalition and the Greater Worcester Community Foundation. They're hosting pregnancy wellness events. The first one is at Girls Inc., and that is with the Worcester DPH. They're hosting a Woo Mama Wellness Day, which is amazing to really provide, again, resources, education, and information about Black maternal health for our entire community. And then the Worcester Greater Worcester Community Foundation and the Together for Kids Coalition, they are having a pregnancy pop-up village. Again, amazing space with a lot of community education, materials, resources, advocacy, of awareness of the various services here in Worcester and what is being done to address Black maternal health. And that's just on Saturday.
Not just tomorrow. Like there's a whole week that just of incredible events that are leading up to it.
One thing I'm really proud about, the first year ever, we're engaging our men. And so through Sean Harris's work, the men's group, I am so proud of this. They are having an event called Kings Raising Kids, Fathers Education Support Group, because men are so crucial because they are the partners of our mothers. have sons and they are brothers, right? And they see this happening within their families. And we need to make sure that men are armed and can step up and advocate on behalf of their sister, their wives, their mothers, right?
Their daughters.
Their daughters.
Yes.
Exactly.
Absolutely.
And so we're so thrilled that we are bringing our men together and fathers to talk about the crucial issues that are impacting our community and the role that men play in advocating on behalf of the women and girls in their lives. So proud of this work. And then on Sunday, on Monday, Worcester Division of Public Health has another convening and summit for public health and healthcare providers, providing more information on policy and advocacy. And then there's a movie screening on Monday focused on our migrant population, which is so important because when you think about, again, I talked about racism and all the threats to, the societal and structural and policy changes, the intersectionality of being a woman of color, but also with a migrant journey, being a refugee or an asylee, non-English speaking, navigating complex health systems with challenges to even health insurance. There's a movie screening that brings this to attention that is happening at the YMCA on Monday evening. And it's called When You Know, Childbirth in the Asylum System. This is something so important
and powerful
to extremely vulnerable aspect of our community that we want to raise awareness and really encourage the community to come out. There's also going to be a game night that the village will be hosting that we're really excited about. And I'm a member of the Central Massachusetts Links Incorporated, and I'm really proud that we are partnering with Girls Inc. to host a menstrual health equity event because we want to target our adolescents, our teenagers who are future mothers and may have already been mothers, right? Teen moms, and really make sure that we are empowering and uplifting them and centering their voice. And so we're going to be hosting a menstrual equity event, and we have such amazing partnerships with Mass Now, Empower, and My Cycle IQ, which are nonprofit community and state-based organizations doing a lot of work around menstrual poverty and menstrual health equity, and they're going to be joining us delivering educational content and raising awareness for our teenagers, our future mothers.
Absolutely.
And so
absolutely.
This is where it starts.
Yes.
I'm so proud that this year we've been able to reach the fathers and then the adolescents in addition to mothers. So it's just, I'm truly, I have chills because of just how we've been able to broaden our reach and impact every year.
Absolutely. Collectively, it's, it's the holistic, it's the whole family. It's not just one, because, grandparents are caregivers, fathers, they're involved, or they should be involved. And our kids, our girls need to see, they need to see experiences. They don't just need to see their moms stressed out and overwhelmed and overlooked. They need to see that their mom can be the center of attention and the focus and be that important person that, you know what, it's not right what's happening to you. How can we work together and fix this? They need to see it.
Absolutely. And that's where it starts.
That's where it starts. So a whole host of things are happening. I will go ahead and share the QR code and the website and all that just to make sure folks are checking it out. And
I have to highlight a couple of things.
All right, come on, tell me.
One, so we've been talking about how irrespective of our income, education, class, the dire impact of childbirth risk to Black mothers is universal. And so on Wednesday evening, we're going to be showcasing that at the JMAC.
Okay.
We have a film screening of the film Toxic,
Oh,
which
okay.
puts that on blast,
Wow.
center stage. It is powerful.
Wow.
We're going to have a fireside chat with two local community leaders. One of our local community doulas, Saskia Jean Charles, who's a community doula, will be talking about the work that she does, advocating on behalf of her patients. And then Dr. Christina Ba, who's a pediatrician and a policy expert, health policy expert, is going to be sharing her perspective in terms of how can we advance Black maternal health.
Wow.
And that film is so powerful.
Wow.
I really encourage the community to come out because then you can really see through the power of this medium the ways in which this shows up in ways that we don't even think about, that impacts our bodies and the weathering on our bodies as Black mothers. And then to close out the week, on Friday, I'm so thrilled. We have a new partnership with Dance Fitness Collaboration, Centering Joy. We're going to be having a Zumba fitness dance celebration to close out Black Maternal Health Week, which is phenomenal. It's a local organization that does a lot of outreach and education in the community, but centered around fitness and health and movement, physical movement. And for us, it's that is our power, right? Music, dance, physical movement, exercise, and that's our vitality, and that's so important for us to find joy and center joy in this work.
Absolutely.
And so what better way to close off this week with a way to really honor just the collective work of our entire community, our organizations that have really rallied around this work and in this way that anchors joy and movement and dance and music. So just truly couldn't ask for a better partnership with our community organizations to really center and advance this work in such a powerful way.
Absolutely. I genuinely don't know how you're going to do it all.
It's not me. Like, I have a massive team.
Like you have a massive team, but
together.
Are you going to try and attend all of it?
Many of them.
Okay, many of them. Like
tomorrow.
It's incredible. There's so many things. The good news is that there's just so much. So check it out. Make sure that you're going on the website to see, where all the things. I will go ahead and share all the info in the chat. I see you have a couple of things. I want to make sure that you got an opportunity to share everything. So the Joy and Justice Jam celebrating. So this is the final. So next Friday at 7 p.m. So we're going to be sharing all of that to make sure you get an opportunity to check it out. So no, I mean, we can absolutely talk about this all day, right? The systemic racism, it's something that we've dealt with our whole life. And, and I think, but beyond that, there's joy. Absolutely. Because we still have to live our life, right? But we still have hope. We still have to have hope for the future, for our children. We have to continue to advocate. We have to do our duty. We have to do what we have to do to ensure that our experience is not their experience, right? Because that's it. We want each generation to be better than the last.
Absolutely.
So,
and I'm raising princesses right here.
Absolutely.
My daughters are age 6 and 11.
Yeah.
One daughter is right here in the studio.
She
listening
is.
in.
She's listening. So she might be a medical expert at this point. So we'll be curious to see if she's like, I'm going to be a lawyer because. But no, thank you so much for all that you continue to do. I'm going to put an open invitation for you to come back to the show because I think there's so many topics that we didn't touch on. I know that I went to a talk of yours recently. We were talking, I'm not going to say it because then you're going to get into it and we're going to talk about it. But there's just so many things that I think that we can talk about. But I really wanted you to come on to talk about your experience and what you're doing and truly kick off Black Maternal Health Week. I'm so glad I was a part of it. So,
thank you
and
so much.
No, thank you. Automatically the answer is yes. Certainly would love to do anything I can to, as a Black woman, honestly, and even if I wasn't a Black woman, right? And because I think sometimes folks just focus on things that impacts them. And we have to be broader. We have to be human being. We have to be empathetic, right? Because I think society functions better when everyone's doing well.
Absolutely.
Right? Not just one race.
Absolutely.
Not one culture. Right?
A rising tide lifts all boats.
All boats. But we've strayed away from that. But let's hope we can, the ones that are doing the work will absolutely be able to get back to that. So thank you for all that you do. Thank you for being on the show.
Thank you for having me.
Anytime. Thank you for sharing it. It is an honor. It's my honor. I love chatting with you because every time I talk with you, I learn something new. I learned several things. So I appreciate that. Thank you so much. So thank you all so much for tuning in. I have the phenomenal Dr. Crista Johnson-Agbakwu, and just she's a joy. If you haven't had the experience to hear her speak, I encourage you, I urge you, the next time she's talking somewhere, just go. You will learn, your mind will expand. Thank you for everyone that tuned in. I appreciate you. Shout out to our executive producer, Paul Anderson. Black Maternal Health Week kicks off tomorrow. So let's do the thing. And until next time, this is Suzanne.
And I'm Dr. Crista Johnson-Agbakwu.
Ta-ta.
Bye-bye.